Good morning, everyone. It's Jeremy, your friendly neighborhood physical therapist. Today I wanted to show you guys a technique I like to use to help with patellofemoral pain. It's called McConnell taping. You can look up other videos on it if this one doesn't provide you enough instruction. But we've got Whitney here with us. So most of the time with patients with patellofemoral pain, they have an issue with the tracking of their patella, right? Most of the time it's a lateral pull that's too much, which causes pain because of the patella is more riding on the trochlear groove. So we want to help with that with some taping. Now, evidence has found that the taping is a level A evidence for the short term in helping relieve pain, but long-term techniques, we want to focus more on strengthening of the hip, the quad, and making sure there's enough mobility in the patella with some stretching too. So, taping technique, I like to use this cover roll, it's called. And basically what I do first is measure a little bit on the kneecap itself, and I like to anchor it at the sides of the knee, so around the joint line. And so I'll cut two strips of this tape about that wide or that long. This doesn't have to be as exact. Patients with hairier legs than Whitney here might have a little bit more discomfort if you do too much on the tape, but ultimately it's going to help anchor down our other tape that we're going to use. Once you've got these two strips cut, you're going to place them on the knee. So I usually like to put one on the lower half of the patella, and then I kind of overlap the other one to do it just above and put it on the upper half of the patella. Now with this, the patient can just relax, and there's no real pull that you're putting on this tape. This is just your base layer.
Watch me, right? When I go down to a squat, that's the wrong way. See how I'm all right here? This isn't even moving.
That's true. Okay.
This is what we want. See, then this stays, and this moves.
All right. Secondly, here's our other tape. Now this is a rigid strapping tape. It's also called anchor tape. The brand's on the inside of this little tube right here. And so this is what we're going to provide the pull with. So again, I kind of eyeball measure by just hovering over that tape that I did. Find the amount that I want. Just tear off a small piece if I have strong enough fingers. There we go. And then again, most of the time we have a problem with too much pull laterally. So we're trying to pull the patella medially. So we kind of anchor on the side of the knee first, still on that white tape, right there. And then what we want to do is hold down on that side and pull across like so, and tape right there. So that's the first piece. I usually do two. The second one I pull just a small amount tighter. And I usually check for wrinkles in the tape. So underneath this white tape has a small amount of wrinkling, which means we pulled it tighter than the tape underneath, which is obviously what we want to do with that first one. The second one, we're going to try to create a little wrinkle in that brown tape. So same thing we do. We pull just a little bit tighter, and we anchor it over here. So I've got small amounts of wrinkling underneath on that one too. That's the taping technique. Now, the tape usually lasts for 2 to 3 days. Patients can shower with it on, but I always tell them that if it becomes irritating or uncomfortable, they're more than welcome to tear it off. Another thing I like to do with this is before we tape, I like to have the patient perform a squat and an eccentric step down to gauge their level of pain with those activities. After I tape them, I have them perform those two activities again, a squat and an eccentric step down, to again gauge level of pain. Usually patients will have less pain performing the activity with the taping. If not, it's probably not the best choice of intervention for them, but again, it's a trial period. They can take it off if they find it doesn't help at all, but I usually say leave it on for a couple days and find out. So that's a taping technique. Here's a closer shot of what we did. And hopefully that helps. If you have any questions, let me know.